Hello, I am Mini Chakiath Varghese. I am one of the Brandman DNP students, and this is my daughter Ivana Susan, and she
Hello.
has agreed to be my patient for today. Ivana, thank you so much, and you look well groomed, well nourished, and well dressed today, and your posture also is looking good. And Ivana's uh, vital signs have been checked. Her blood pressure, pulse rate, her temperature, the height and weight are all in normal limits. And she has also emptied her bladder. Even if you experience any pain or any discomfort during the procedure, please let me know. Your privacy will be maintained at all times. For today, genitalia and breast examination will be deferred, but I'll be explaining about it later. I'm going to wash my hand before we begin the head to toe physical examination. First and foremost, I'm going to check your skin, your hair and your nails. For the skin, I'm going to look at her skin hypo or hyperpigmentation of the skin, any lesions, any scarring, the hair distribution, the temperature of the skin, and for the skin turgor. And I'm pinching her skin and letting it go. It should go back to the normal shape, and in her case it is. And for her hair, I'm looking her hair distribution and the texture of the skin, and it looks good. For the nail, looking at her nail bed to look for color, the contour, and for any clubbing, and also for the capillary refill. And in her case, it's almost 1 second, which is normal. Now we are moving on to checking your head and your face. For your head, I'm looking at the shape of the head, any asymmetry or any abnormal growth. And I'm going to palpate her scalp to look for any lumps or any bumps, any lesions, any abnormal findings there. And also the scalp for dandruff or any lye infestation, and I don't see anything. For your face, I'm going to actually palpate her frontal sinus. Any pain?
No.
Maxillary sinus. Any pain?
No.
Ethmoid sinus. Any pain?
No.
I'm going to check for the temporomandibular joint, which is TMJ. Can you please open your mouth? Can you chew? Okay, it looks okay. And now I'm looking at your eyes for your eyelashes, eyelid, and for the eyebrow. I don't see any discharge or any redness or any discoloration there. Looking at your sclera, and it looks white, which is normal. If it was yellow, it could have been jaundice. For her conjunctiva, it looks pink in color, and if it was red or any discharge, that means it could have been conjunctivitis. So I'm going to look your eye for direct and consensual light reaction. So I have the pen torch here. Ivana, please look at the light here. I'm looking at her left eye, and I can see the pupillary reaction, which is the direct reaction. At the same time, her right pupillary reaction also is going towards the pen torch. So that is the consensual pupillary reaction, which is normal. Can you tell me when you can see my wiggling finger? Okay, that's normal. I'm going to look at the accommodation test also. Can you please look at my finger? And look away to there, and again look at my finger. I can see that her eyes are moving symmetrically and without any problem there. Now I'm going to move on to checking your ear. Actually, for the shape and for any kind of abnormalities there. And for the pinna, I'm going to look at the to see if there is any pain or any kind of discharge coming from there. Is there any pain?
No.
All right. So I'm going to use the otoscope to check her eardrum. So for that, for the kids, I need to pull it down, the pinna, but then for the adults, I need to pull it up and backwards. So Ivana, I'm going to put the otoscope in your ear. Okay, your eardrum is nice white and pearly color. Pearly white is normal, and if it was red or yellow, that means there was an infection there. Okay, now I'm palpating your mastoid process. Good. Looking at this ear too, looks alright. Now we are moving to check your nose. Looking for any asymmetry or any kind of nasal deviation. I don't see anything. I'm going to use the pen torch one more time and look up, and I'm going to look for her mucosa, any turbinate or any bleeding or any discharge, which I don't see anything. Can you please close one nostril and breathe? Good. The other one? That's great. She has no obstruction there, which is great. Now we are moving to your mouth. For your mouth, I'm also looking at her lips to see if there is any signs of dehydration or any lesions. Can you please open your mouth? I'm looking at the hard palate, the soft palate. Can you please put the tongue out? Okay, the symmetry of the tongue, and to see if there is any, that's great, abnormal growth. Can you say ah? I'm looking at her tonsils, the pillar and ulna, and her teeth to see if there is any issues there, which I don't see anything. I'm going to palpate her periauricular sinuses, post-auricular sinuses, her tonsils, her submandibular sinus, and her thyroid. And I don't see any problems there, which is good. Now we are moving on to checking your cranial nerves. So the first cranial nerve is olfactory, which is for sense of smell and taste. So mainly, I'm going to ask Ivana to see if she can smell the difference of this. Can you please close your eyes for me and close one nostril? And can you breathe and tell me what it is?
Coffee.
It's coffee, that's correct. And can you please check this one and tell me what it is?
Masala.
Okay, so Ivana, your sense of smell is good. Now we're moving on to the second cranial nerve, which is the optic nerve, which helps with your vision. And I'm going to use the ophthalmoscope to check this. And I'm going to look at the optic disc. So can you look away for me? And I'm going to check your optic disc, and I can see her optic disc like 2 inches away from her eyes. And in your case, I don't see any problems, Ivana. You have no signs of glaucoma or diabetic neuropathy or any other issues. All right. Now we are moving on to checking for the next cranial nerve, which is cranial nerve number 7, facial nerve, which helps with expressions in your face. So can you please clench your teeth, pop out your cheek, and also wiggle your forehead? That looks good. All right, now we are moving on to checking her cranial nerve 3, 4, and 6, which helps with the actually her eye movement. So there is a test called 6 cardinal gaze sign. Okay, so you're going to look at my finger, and without moving your head, you are just going to look the direction of my finger. All right. Okay, to the upper left, far left, lower left, middle point, upper right, far right, and lower right. I can see that her cranial nerves are, which helps vision, are working very good. Now we are moving on to the cranial nerve 8, which is helping your hearing. For that, we need to have 2 tests done. One is Weber test and the other one is ring test. I got to use the tuning fork for this. So I'm going to tap here and put the end here. Let me know if you hear the sound in both here symmetrically. So can you hear in both ears? Good. Now the next one is the ring test. For that, I'm going to do this and going to keep the part here. Let me know when you are done hearing that, and I'm going to put that in your ear to see if you can hear it. All right? Okay. Yeah. So this means that her air conduction is better than the bone conduction, which is normal. Now we're moving on to cranial number 11, which is accessory nerve. Can you shrug your shoulder against my finger? That's great. And now can you please put your cheek against my face, and also the same way? Okay, that's great. Now we are going to check her cranial number 5, which is a trigeminal nerve, which is helping you with the sensation. So I'm going to do the cotton ball test. Close your eyes for me and let me know where I am putting the cotton ball.
My forehead, my nose, my cheeks.
Okay, that's great. Now we are moving on to the next cranial nerves, which is cranial nerve number 9, cranial number 10, and the last one 12. Okay, and that is for gag reflex and also for the cough reflex. Can you please cough for me? Okay. Now I'm also going to use this tongue depressor to check your gag reflex. Okay. Okay, I can see that her gag reflex is good, so those nerves are working. So all your cranial nerves are intact. Moving on to your chest and your lung examination. Can you please turn back for me? I'm checking her to see if there is any asymmetry or shape or any problems that I see there, any lesion scarring. I'm going to auscultate Ivana. Whenever the diaphragm touches your back, please take a deep breath, okay? Okay. Can you do like that for me? Okay, that's great. I don't hear any problems there. There is no signs of radial stronchi or wheezing. Now I'm going to do a test called tactile primitus. Ivana, when I touch my arm, can you please say 99?
Yes. 99. 99. 99.
I can hear the vibration, which is the good sign that there is no problems there. Now I'm going to look for respiratory exertion. I'm going to go to the 10th intercostal space and ask Ivana to take a nice deep breath, and I can see the thumb movement. Can you take a nice deep breath? And exhale. Okay, I can see the movement, and that is good. Now we are moving on to the diaphragmatic exertion. For the diaphragmatic exertion, can you please take a nice deep breath and hold? I'm going to do the percussion. I can see the dullness. Can you exhale completely and hold? Don't breathe now. Don't breathe. Don't breathe. Just exhale completely. Okay. I can hear that. I can see the difference of the diaphragm movement during her full inspiration and full exhaling, and the difference is 3 to 5 centimeters, which is normal. So can you move towards the front, and I'm going to check her anterior part of her chest, and even I'm going to check for your lung sounds, and I don't see any problems, no asymmetry or any abnormal growth, and I'm going to ask you to take a nice deep breath. That's good, sounds good. There is no problems there. Moving on to the cardiovascular, I'm going to start with checking the radial pulse for the rate and the rhythm. Rate is anything between 60 and 120 is normal. Checking for the brachial pulse. And I'm going to check her jugular pulse using the belt too. Now I'm going to check her other murmurs, heart murmurs, to see if it's normal. So I'm going to start auscultated. So in her second intercostal space on the right side is the aortic murmur. On the left side, second intercostal space is her pulmonary murmur. An inch below, a Kerb's point. On the fourth intercostal space, I can hear the tricuspid pulse. In the mid-clavicular line, on the fifth intercostal space is the PMI, or the apex, or the good sound there. Now I'm going to use the bell and going back the same direction, the mitral valve movement, tricuspid, Bell's point, her pulmonary and the aortic. In your case, everything looks good and there is no split S1 sound or there is no S3 or S4 sound. Everything looks okay. Moving on to checking your abdomen. So I am going to palpate to check for her 4 quadrants of her abdomen, and I'm going to auscultate that too. So auscultate the 4 quadrant. And I'm checking for the aortic pulse, for the renal pulse, for the iliac pulse, and for the femoral pulse. Checking for her normal bowel sounds. Repeating the same thing over there. And also I'm going to palpate to see if there is any lumps or any bumps or any pain there. Okay, let me know if you experience any pain. Any problems?
No.
Everything okay?
Yes.
Alright, that concludes that examination. Now we are moving on to checking your central nervous system. Okay, for that there are some tests that we need to do. Okay, first one is finger to nose. So please touch my finger and touch your nose. Touch. That's great. Now we are moving on to checking your rapid alternating movements. So can you do like this for me? That's great. If she had any cerebral dysfunction, she wouldn't be able to do that. Moving on to the Romberg's test of approximation. Can you please stand up and close your eyes for me and stand straight? Keep your legs together. She's able to do that without leaning forward or moving anywhere, and this is very normal. It is negative Romberg's test, but if she was having a positive Romberg's test, then she might be falling or leaning to the another side. Can you please lie down for me? I'm going to do the shin to toe test. So keep your legs straight and can you bend your knee for me? And can you take it slowly down, slowly? Okay, do the same thing on the other one, please. Okay, can you put it back? That's great. So that test is also good. There is no cerebral dysfunction there. Can you do shallow bends for me like this? Okay, that's good. Can you do some couple of normal walks? Just walk normally. And can you walk on your heels, please? On your heels. Good. Can you walk on your toes? Okay. And then there's another thing called tandem walk. Can you walk on your heel to toe for me, please? Can you walk without looking down? Can you do a straight walk, straight line walk, heel to toes? That's great. Can you walk back too? Without looking. Awesome. That's perfect. So I don't see any problems there. Now we're going to do palpation test. I'm going to test to see if you're able to tell me if it's sharp or dull. Can you please close your eyes for me? Let me know if it's sharp, okay?
Sharp. 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 Dull. Dull. Dull.
That's great. She was able to tell that. I'm also going to use the vibration test. So I'm going to tap and put the other side on the bony prominence of her fingers and knees. Sorry, the toes. So can you hear the vibration? The bony prominence, so she should be able to hear the vibration. And also I'm going to do the same thing on the toes. So let me know if you hear the vibration. You hear it?
Yeah.
That's side too? Okay. So that concludes the central nervous system examination. Moving on to checking for the radio, the reflexes, the deep tendon reflexes that we have. So first I'm going to check for the radiobrachial tendon reflex. I'm going to use a hammer for that. So Ivana, I'm going to tap there and let me know, so you can see the movement here and also the contraction. So leave it loose. You can see the movement there and the contraction. So that is good. That is C5, 6 and 7. Here is the triceps. I'm going to tap again. You can see the contraction and the movement here, and that is also 5, 6 and 7. But the biceps has the maximum tendon reaction reflex. So leave it loose and I'm going to tap here. You can see the movement there and the contraction there, which is good. Moving on to your patellar groove. I'm gonna tap here, Vanna. All right, are you all right?
Yeah.
So tap there and you can see the contraction there and the movement here. Going to the acrylic place, for the acrylic, I'm going to tap there and you can see the movement here and the contraction there, and also going to the Varghese sign and to check the plantar flexion. So I'm going to do like this, okay? And you can see the plantar flexion there. So that concludes that exam. Now we are moving on to checking your musculoskeletal system. So for that, I'm going to start checking your joints first. So let me know if you feel any tenderness or any pain here. There's no swelling, which is good. I'm going to ask you to do some range of motion exercises, okay? Can you flex, extend, abduct, and adduct? Great. Now we're moving on to checking your radial joints. Looking for any pain here?
No.
Any tenderness? There is no swelling here, which is good. Can you do flexion, extension, adduction, and abduction? Please do it for both arms, okay? And now we are moving on to checking your brachial joint, and here you're looking for the medial epicondyle and here is the lateral epicondyle. Do you have any pain here?
No.
I'm checking for the tennis elbow and olecranon prosa, and we're going to do some range of motion exercise here. So can you do flexion, both flexion, extension, supination, pronation and supination? That's great. We're going to the neck and her shoulder joints and checking for the clavicle and also for shoulder bone. Have any pain here?
No.
The shoulder joint. Okay, can you please stand up for me? Can you do flexion all the way, extension, and can you touch here, scratch here at the back? That's internal rotation, and scratch all the way there. That's external rotation. So she has no problems there. I'm looking, can you please lie down, Ivana? I'm going to check her hip joint. I'm going to actually locate her sciatic notch. In the sciatic, it's in between the iliac spine and the trochanter bone. And iliac spine, I'm looking for any pain here. Do you have any pain? There is no, I don't see any swelling, and it looks good. I'm looking for a range of motion exercise. Can you please lie straight down for me, straight for me? Can you lift your leg? Okay, that's flexion, extend. Okay, can you go there, adduct, and here, abduct. Okay, that's great. Can you please sit down there for me? Thank you. Okay, so here is her knee patellar groove. Again, palpating for any pain, any redness, any tenderness there. Okay, I'm looking for the lateral epicondyle and the median epicondyle, and also looking the posterior aspect of the patellar groove. I don't see any problems here. Can you stand up for me? Can you do flexion, extension, adduction, and abduction? Okay, that's great. Can you sit down for me? And I'm also going to look at the calcaneus bone and the metatarsal bones, and I don't see any problems there. There's no swelling. Any pain when I'm touching here?
No.
All right, okay. So can you do flexion, extension, and inversion and aversion? That's great. Okay. Now I'm going to also look at your strength of the muscle. Can you push, when I am pulling it up, can you push down for me? Can you push down? Down. Do like this. Okay. Okay, that's great. Push down. Use all your strength. Push down. All right. Can you lie down for me, please, one more time? And you're going to push down. Okay, you're strong. Can you push down? Also, can you do like this for me? Okay, good job. Now we are going to look at your spine, looking for any asymmetry, and I'm going to palpate your spine to see if there is any pain there. Any pains?
No.
Okay, let's do some range of motion exercise.
Okay.
I'm looking for her cervical portion of her spine, and I'm going to ask you to do some range of motion, okay? Can you do like this, flexion? Do like this, extension, and can you look that side? That's okay, that's great. This is left rotation, and that's left rotation, right rotation, lateral rotation, like this. Okay, that's good. You got it. Now I'm checking for a lumbar spine to see if the range of motion exercise there. Can you please bend? Okay, that's flexion. Do like the extension. Do like the same way, like left rotation, and then lateral rotation, and here lateral rotation too. Okay, you were able to do that. That's great. Now we are not doing her breast examination, but for the breast examination you can do both lying down or standing up position. I will ask the patient to lift their arm, and I will be looking for any asymmetry there, any problems, discharge, any discoloration, any bleeding, and also we'll be looking to palpating to see for any lumps, any bumps, or any pain there, tenderness. And for the genitalia, I'll be looking also for any sexually transmitted disease, any bleeding, discharge, or any palpating for any kind of bumps or lumps or lesions. And that concludes the head to toe physical examination today. Thank you for watching, and thank you so much. Do you have any questions, Ivana?
No.
Okay, thank you.
You're welcome.